Affect displays are the movements of the face, hands, and body to communicate emotions. I would explain these in 3 topics, which are the affect displays we use in the workplace, in the form of gestures, and the medical aspect of them in psychiatric and neurological disorders. First, I'll explain the importance of affect display in the workplace. Gestures or movements of the head, hands, arms, and legs can be used to convey specific messages. For example, a person might use a wave of their hand rather than saying hello or nod his or her head in agreement, which means yes or okay. These gestures can be very useful in the workplace because they're a quick way to convey thoughts and feelings without needing to speak or write. Many affect displays are commonly interpreted. For instance, people who sit in a slumped position and frown are believed to be disinterested or unhappy. Those who sit upright, smile, and have raised eyebrows are seen as interested and happy. While these affect displays are often appropriately interpreted, they may not be related to the interaction with another person and thus may be misread. For instance, if a person has a terrible headache, he may squint, look down, and grimace during a conversation, indicating to the speaker that he disagrees with her, even if he is receptive and even in agreement with the speaker. Other examples are adjusting one's clothing, biting one's nails, or fidgeting and toying with an object. Those might indicate to others that a person is upset or nervous, and behavior such as this during a job interview or meeting with a coworker may be interpreted very negatively. A person who engages in such behavior may be seen as preoccupied, anxious, or even dishonest. As with affect displays, such body language may not convey true feelings. A person who fidgets and bites her nails may be exhibiting such behaviors for innocuous reasons. Thus, while such behaviors are often interpreted correctly as presenting anxiety, they do not necessarily indicate that a person is in any way dishonest. When listening to others, individuals often convey messages nonverbally. Therefore, care should be taken to avoid the following. Sitting or leaning back is a body movement that may convey disinterest in a speaker's words or disagreement with the speaker. Additionally, resting your chin on your hand may convey boredom. Conversely, leaning forward, slightly raising eyebrows, and making eye contact indicate that you are receptive to the speaker. Crossed arms often display a defensive posture, which can indicate that a person is unhappy with the speaker, feels threatened by the speaker, or does not want to listen to the speaker. Fidgeting or playing with object may indicate that you are nervous around the speaker or disinterested in the speaker's message. Those are the reasons why we should be aware of our use of affect displays, especially in the workplace. Furthermore, I will discuss the use of affect displays in the form of gestures. There are many known gestures that we use to convey certain emotions in affect display. For example, rolling up your sleeve to show confidence and that you're ready for action. Forming a heart to show love. Rubbing your hands together to show excitement and expectancy. Or shaking a fist to show anger and aggression. These examples were found from an unknown author on the internet page Study Body Language that were published in the years from 2012 to 2016. Those are just a few of many, but the one I believe is the most important is sign language. A whole language made up of affect display. 70 million people worldwide use affect display sign language to make themselves heard. American Sign Language, short ASL, is a complete natural language that has the same linguistic properties as spoken languages, with grammar that differs from English. ASL is expressed by movements of the hand, face, and body. It is the primary language of many North Americans who are deaf or hard of hearing, and is used by many hearing people as well. ASL consists of the alphabet of 29 signs and around 6,000 words in the vocabulary. But depending on how the person signs a word, for the example, the word big, with extra expression of the mouth and face, the meaning can go from big to huge or humongous. which is why affect display is one of the main components of sign language. The emotions that are delivered with sign language is what defines the message that the person wants to bring across. Lastly, I will show the medical aspect of affect display in psychiatric and neurological disorders. If struck by an illness, the resulting partial or complete loss of facial functions or limb functions has a huge impact on the way we communicate and how we convey our emotions with it. Flat affect is having a lack of emotional expression. It is a symptom typically observed in people with schizophrenia, autism, depression, or traumatic brain injury. A person with flat affect may appear unresponsive to the world around them. The psychology term affect refers to one's expression of emotion as demonstrated through facial expression, tone of voice, or body language. It represents the degree to which our outer emotional expressions match how we are feeling on the inside. Less severe versions of flat affect are restricted affect and blunted affect. Flat affect is different from apathy, which is the lack of emotion, in that feelings that may simply be unexpressed rather than totally lacking. For example, a person with flat affect may feel anxious or surprised, but will not express these emotions through facial expression, tone of voice, or body language. This is supported by the ongoing theory that flat affect is the result of brain abnormality involving motor function rather than emotional processing. In schizophrenia, flat affect is considered a negative symptom, indicating a lack of something, and is a strong determinant of a patient's treatment outcome. Those with flat affect often fare more poorly than those without flat affect. Research has shown that flat affect is more common in men than in women. One study found when schizophrenia patients with flat affects are speaking, they're less fluent and use less inflection. These patients also used fewer words and spoke in smaller sentences. Another study found that schizophrenia patients with flat affect have reduced activation in the limbic system when viewing emotional stimuli. In conclusion, with elaborating affect displays in the workplace as gestures and in the medical aspect of psychiatric and neurological disorders, you can see how important they are in everyday life.